Hey everybody, Dr. Julie here from McLaughlin Care. Today we're going to talk about something not so near and dear to my heart, long COVID. I am a long COVID survivor, and I'm happy to tell you after 16 months, I feel that I'm fully recovered, which is really good news because it gives others hope that their recovery can occur. But I know there's millions of people that are still suffering. So one of the things we're going to talk about today is the vagus nerve. And the vagus nerve is super, super important because COVID affects this nerve and it causes a lot of dysfunction. And you're like, what the heck? What kind of nerve is the vagus nerve? Well, it's a nerve that runs from our brain into our bodies, into our heart, our lungs, our intestines, several muscles. It affects swallowing. It affects your heart rate. It affects your speech, your gag reflexes, sweating, digestion. And they found studies that 66% of people with long COVID have at least one, if not three, deficits in this nerve that are giving them symptoms, right? So that's a really big deal. So you can see from my little diagram here, all the different organ systems that it affects. And those are the things that we're seeing that's being affected by COVID. What are we going to do about it? How are we going to help re-stimulate that vagus nerve to start to work better so we can have elimination of some of these symptoms? So I'm going to give you a few things that you can do to help with this vagus nerve. Now, I know the vagus nerve in my body is affected. My lungs, it's definitely affected my voice. It affected my stomach. So some of these things, depending where it's affecting you, are going to be more effective than others. So the first one is you're going to breathe more slowly. So you're going to aim for 6 breaths a minute. And sometimes you can do that box breathing where you're doing inhale as you're going here, exhale, inhale, exhale, as you're drawing a little box, and it will slow you down. The other thing is I want you to breathe more deeply from the belly. Think about expanding your abdomen and widening your rib cage as you inhale. That's going to help stimulate the vagus nerve. A longer exhale, the longer exhale you have is going to trigger relaxation response. Loud gargling. See, it's affected my voice. Loud gargling with water and getting like way back in your throat, or loud singing. And you don't have to do it around other people. You can do it in the car, but that's going to activate our vocal cords, which in turn is going to stimulate our vagus nerve. Foot massages, gentle or firm touch on the foot can stimulate the vagus nerve. Cold water on your face or neck, or even submersing your face in the ice bath real quick. Do at least your forehead, your eyes, your neck, and like at least 2/3 of both cheeks in the water. That will definitely elicit a vagus nerve response. It's going to decrease your heart rate. It's going to stimulate your intestines, and it turns on your immune system. Eating fiber is going to help with the vagus nerve because it's going to have the brain slow those gut impulses down, and you're going to feel fuller after meals. And what about laughing? So if you can laugh, that's going to obviously boost your mood, but it's also going to affect your immune system, and it's going to stimulate your vagus nerve. And of course, chiropractic manipulation is always good for your nervous system. And so those are my tips on how to stimulate the vagus nerve to help recover for some of these long COVID symptoms. That's it for today. I'll see you soon.